Distancing. And actually, if I could ask you to stand just a little bit over that way. We're gonna make sure we got 6 feet, right? All right. You guys are gonna stand 6 feet apart too. Great. 6 feet, Kathy, there. Okay, well, great. That's about the limit we can do. All right, see, we're practicing good social distancing here. Well, good afternoon, everybody. Thank you very much for being here today. Obviously, we have an unprecedented situation with regard to the coronavirus here in our state and in our country. And we have taken some pretty dramatic steps to be able to prevent the spread of the virus. And I want to thank all the people and organizations that are taking these steps to make sure we protect the most vulnerable people in our society. Older Nebraskans with underlying health conditions. That's what this is all about. Those are the people we're trying to protect. And we've taken a number of steps to do that. I want to thank all the folks who are helping with that. We've issued guidance with regard to, for example, restaurants and bars. And yesterday, of course, was St. Patrick's Day, a big day for our bars and restaurants. And I want to thank all the bars and restaurants who helped comply with the 10-person rule. I had stories of people going to a bar to get a pint of Guinness and being told there were already 10 people in the bar. I know our grocery stores are doing a great job at Costco here in Lincoln. They've put up signs saying stay 6 feet apart. They're washing down their carts with sanitizer. They're disinfecting the belts that take the groceries up to the cash register between every patron. They're getting their patrons to stay 6 feet apart in line. Really doing great work to help make sure we have that social distancing. And I really appreciate everybody who's helping to work to do that. That is so vital for us to take the steps to slow down the spread of the virus. Today, we're going to give you an update about some of the things that we've got going on. And as you all know, this is something that changes seemingly by the hour. In fact, just before I came in here today, I was made aware that Dr. Adi Poor at the Douglas County Public Health Department has confirmed a second community spread case in Omaha that she will be announcing later this afternoon. Now, I do not have a lot of the details around that other than she has a second community spread case, and so I really defer to her press release that she is going to be giving later this afternoon, but we felt it was important, since I was going to be up here talking, that we get that news out, that she has that, and that she will be talking about that later this afternoon. And per our previous guidance, that will trigger additional steps from the state as well. Now, as you all are aware, Douglas County put out a directed health measure this morning that issued guidance or had part of it. We, the state, will be doing a similar thing. And again, I remind people we're going to do it based on ESUs. So we will be putting out our own directed health measure, or DHM, later with regard to the ESU for 19 in Omaha and 3, which is adjacent as well. So I would say stay tuned for that. We don't have the details on that yet, but again, this is rapidly developing. So again, we wanted to just make you aware of that. We also wanted to talk about some of the things that with regard to daycares, as we've been getting a lot of questions about that. And again, the guidance from the CDC was 10 people, and so we've put out guidance, and we'll be having that guidance posted on the Department of Health and Human Services website, which is dhhs.ne.gov/coronavirus. That guidance will be posted after this press conference. But broadly speaking, again, what it is, it's about limiting those crowds to 10 people or less. So 10 kids per room in a daycare, which means that you cannot have kids mixing, so no recess together, no eating together, anything along those lines. And I've got Teresa Thibodeau, who runs her own daycare, is going to be saying a few words a little bit later about that. So that's a key important thing I want people to know, is that we have that limit with regard to the daycares. And we want daycares to prioritize people who are going to be protecting the public safety, our healthcare workers, so for example, law enforcement, corrections officers. Those are the types of families we want to see prioritized in daycares to, again, make sure that we're doing our best job to be able to help protect the public safety. So again, we're going to be issuing those guidelines, but again, we want people to use common sense, but at 10 kids per room, don't mix the kids, recess, things like that. That's what we're looking for from people. And it's been the same kind of guidelines that we've had, for example, with regard to restaurants. You know, with regard to restaurants, we said for the dining capability, 10 patrons, doesn't include staff. For the child care, 10 kids, does not include staff. So you can have 10 kids in that room and staff on top. Restaurants, same sort of thing, 10 patrons plus staff. Now, obviously, in the Omaha area, that will be changing because of this second community case. And we were going to be going along the lines of what we had put out the guidance previously with regard to when we got 2 community cases in Omaha. We'll be asking restaurants to go to either takeout only, drive-through, delivery. We encourage restaurants, for example, to change serving staff into delivery staff in the Omaha area so they can continue to serve the people. We will be making other announcements with regard to bars, and again, unless the bars have that capability to do delivery for food service, we're going to ask them to close down. And again, schools are generally closing down already, but that'll be a part of our DHM. But stay tuned for more on that as we get this all pulled together. But if you go refer to our guidance from last Friday, you'll see a lot of the steps that we're going to be taking with regard to the state DHM, specifically with regard to the 2 community cases that we have in Omaha. Also, we're going to continue, just wanted to say thank you again to the restaurant and bar industry and the grocers. So the grocers have also been great. I mentioned the Costco and what they're doing, the steps they're taking to keep customers safe. We have a very strong supply chain here in Nebraska. We have a very strong supply chain across our entire country. Most of our food is produced domestically. So we want people to go get 2 weeks supply of groceries in case you have to quarantine at home for 2 weeks. But don't get months and months. You don't need that. Don't overbuy. You can go continue to shop weekly to get needed groceries. Grocery stores will remain open, like I mentioned with the Costco and all the steps they're doing to keep people safe. So we don't want people to overbuy. We have strong supply chains. On Friday, I signed an executive order that released the weight limits on trucks and service of our operations on food trucks, so that they can continue to be able to keep that supply chain strong. Here today to be able to help talk about this, we've got Kathy Sifkin, representing the grocery industry, and Zoe Olson, who's representing the Bar and Restaurant Association, from the Restaurant Associates Association. And so with that, I'm going to go ahead and turn it over to Kathy Sifkin, who's going to talk about the grocers, and Kathy and I are going to continue to keep that good social distancing, which of course we want to remind everybody. Social distancing, elbow bumps, cough into your elbow, wash your hands often, 20 seconds each. Happy birthday twice works. I've timed it, it works. Wash your hands frequently, use hand sanitizer, stay away from sick people, 6 feet distance. All that sort of good social distancing will help us slow down the spread of this virus as well. And with that, Kathy, I'm going to turn it over to you.
Thank you, Governor, for calling this press conference and allowing us to send our messages out to the citizens of the state. As we have reported to the media over the last week or so, there is no food shortage. There may be some items that are not available, such as sanitizing chemicals and paper products, but that's only because people went out and purchased more than they actually needed, and so now there is a shortage of those items. We are working on trying to fill up the supply chain or the pipeline with those items, but that will take a little bit to get those items back. But there is no food shortage. We have plenty of food across the nation to feed everyone. The supply chain system is stable, and it is working very, very well. More food products have been purchased than normal in the last week or so, and that caused the gaps in the pipeline, and we are in the process of filling those gaps as time goes on. So if you go to the store today and the products that you are looking for are not on the shelf, we recommend that you go back in a couple of days, because that will give the clerks and the stockers time to fill those shelves. The larger stores in larger communities are receiving multiple trucks on a daily basis. The small stores in rural communities, normally without this coronavirus, usually get 1 truck per week. They are still getting 1 truck per week, and they are adding loads on. So in the long run, everything is almost back to normal, except there are some products where there will be a shortage. And we anticipate that approximately 70% of the products that are normally in a grocery store will be in the grocery store. The supply chain is managing their resources, and by that I mean the manufacturers are allocating product to each warehouse based on what they've ordered in the past. And in turn, those warehouses are allocating product down to the grocery stores. So it doesn't make any difference who you are. Your allocation will be a percentage of what you received in the past. There will be no shortages. Everyone will have access to food. The safety and health of our customers and employees is of utmost importance to us. We would like to thank the employees that work in the supply chain, all the way from the manufacturers who have geared up production to over 120%, to the truckers that are driving the trucks down the highways, to the people in the warehouses that are unloading trucks and then loading them back up, to the store employees who are stocking the shelves, just to make sure that everyone has access to food. Contingency plans have been developed and everything is working. It takes a team to make this work. The team has been assembled and everyone is working together. The clerks in our grocery stores, in my mind, are really the real heroes. They are the people that are on the front lines. They are interacting with the general public, and they are working extra hours to make sure that the food is on the shelves. I would ask that when you go into a store, that you be mindful of the sacrifices that our clerks have made, and I would ask you to consider these things. Number one, don't bring your entire family to the grocery store to shop. Designate one shopper. Keep social distances, including those with our clerks, to a minimum of 6 foot. Cashiers are within that 6 foot distance, so please step back. Give them room to breathe. This is going to be a difficult one for some people because we are environmentally friendly, but we are asking you, do not bring your reusable bags back into the grocery store. Please use the single-use plastic bags. The bags, the recyclable bags, can be contaminated, and when you carry those bags through the store, you could spread that contamination. So please use the plastic bags that are available at your store. Don't bring the recyclable ones back in with you. If you have any at-risk family members, please shop for them. We know that our customers all deserve access to affordable, fresh food and essentials. Some stores have asked that the first hour of operation be reserved for those most at risk. My message to everyone in this state is, you don't have to wait for the store to make that announcement. You can choose to not shop the first hour and let the elderly and the at-risk population do their shopping during that time and just do your shopping later in the day. We're asking that our customers be patient, be kind to one another and our associates, and to shop responsibly and to purchase only those items that you need, knowing that we will continue to stock those shelves. We simply need to use common sense and to think about what we're doing and to continue to be part of the solution. And that is the same things that the governor just mentioned. And that would be stay home if you're not feeling well, cover your mouth if you sneeze or cough, keep a social distance of 6 foot, and make sure that you wash your hands frequently. We are Nebraska strong, and together we can get through this. Thank you, Governor.
Great. Thank you, Kathy. That's a great example of how Nebraskans are stepping up to be able to meet the situation and deal with it. And I just want to reemphasize, again, what Kathy said about use common sense. We want to follow all the guidelines with regard to social distancing, but when it comes to applying some of this, use common sense, like letting older populations who may be at more risk shop that first hour of the day. Thank you very much for that. Now I'd like to ask Zoe Olson to come up and talk on behalf of the Restaurant Association.
Thank you, Governor, and thank you for your leadership on this important issue. None of us have been through this before, and so it takes all of us to make sure that all of us remain safe. And speaking about safe, restaurants have been practicing safe and sanitized procedures for decades. We have a robust health department throughout the state, and then local health departments are also very robust. We have some of the strictest health codes in the nation. And so, as I've said to a couple of media members throughout the past couple of weeks, I actually feel safer eating in restaurants than I do some of my friends' homes. And why is that?
We won't ask you to say which friends.
I will not, thank you, and you know who you are. So I wash my hands in my kitchen sink when I'm cooking. Well, in a restaurant, you don't do that. You have a separate hand washing sink. And chances are, if you're, well, not chances are, you're using gloves on top of the hand washing. We also sanitize sinks. We wipe down tables after people use them. We sanitize. None of my friends have a 3-compartment sink where they wash dishes, rinse dishes, sanitize dishes, okay? So restaurants are safe. Our staff members test, study, and are certified in health practices. And they don't just do that once at different intervals. They study again, they test again, they recertify again. We are, Nebraska Restaurants, a backbone of Nebraska's economy. And I want you to think that Nebraska restaurateurs, the owners, the staff, the reason we're so serious about this is that we're serving our communities, we're serving our families, we're serving our friends, we're serving our colleagues. It's important to us to keep everyone safe. So, today is #CarryOut Wednesday. In Omaha, we'll be doing carryout every day from here on out until further notice. But remember to support those local restaurants because we want them to be in business. These are strong people in your communities. Remember, you can call ahead and say, I would like this for dinner and I'll be there at this time to pick it up. You can ask for delivery service. You can go through the drive-through. All these options are available, but please continue to know that our restaurants are safe. And if you want to help restaurants even more, at this time you could buy restaurant gift cards from the restaurant directly and use those in the future when you get to go out and dine out more. This will help them with some cash flow that they're going to be short in the coming days. So we're all in this together. We are Nebraska. We don't have the situations that we're seeing in other communities because we take care of each other. So let's continue to remember that we're all in this together. Thank you.
Thank you very much, Zoe, and I love your idea about the gift cards. In fact, I was one of our local neighborhood restaurants talking to the owner there, and that's one of the things that he mentioned as well as far as being able to help out through this time is buying those gift cards. So that's a great example there. And again, restaurants and bars, great example of stepping up to be able to address what we're seeing here in Nebraska. So thank you very much, Zoe. And now another example of an industry that is stepping up to be able to help out our communities is the daycare industry. And I've got Teresa Thibodeau with Primrose that is going to be saying a few words about the daycare industry.
Thank you, Governor, and I would like to say thank you, Governor, very much for reaching out to the childcare industry when you were developing guidance for us to follow. It is a huge task to undertake when we are closing down schools to try to keep childcare facilities open and keep our public safe at the same time. The Governor's office has been amazing at trying to keep this balance, and childcare owners, we need to say thank you. And now it is time to step up and do our part. It is going to be hard to follow the 10 children per classroom, especially if you're used to having a larger census in your building. However, this is what we can do to help serve our essential workers with mitigating the exposure to our community and to our most vulnerable people. So I ask everyone that if you are in a child care facility and you have the option of working from home and having your children home, please keep your children home and open those spaces for those who are in our military, our healthcare facilities, our first responders, our fire, our paramedics, our police. It is essential that those people can continue to work so that they can provide safety for our community as well as help treat the people who may become ill with this virus. Again, the daycare industry, much like the restaurant industry, is a very highly regulated industry. The cleanliness procedures for child care centers are above none. Every child care center I know uses hospital-grade disinfectant, and so our centers are clean. We are required to clean those on a strict basis every day, but we are going to even do more. Instead of doing it 3 times a day, let's do it every hour. Spray those toys down, because we do need to teach social distancing, but everybody in this room knows it's a little hard to explain to a 2-year-old that you need to stay 6 feet apart from your friend. So we can do that when they're sleeping, but when they are awake. Again, which makes sense about the 10-person rule. But practice hand washing with them. Make it a game, make it fun, make it positive. Don't scare them.
Sing happy birthday twice.
There you go, yes. Or the ABCs or Twinkle Twinkle Little Star,
those
whichever
are two,
you prefer,
okay.
yes. If you sing fast, then it doesn't work. So please remember that, employees of child care centers, you guys are on the front lines. It is your duty to make sure that the children are washing their hands, that when they come in, they don't have fevers. Some of you may want to start checking children as they come in the door. Do not let a child in your facility that has a fever of 100.3 or greater. Parents, please keep your children at home if you are sick. Child care workers, I know it's hard. It's a hard industry. Excuse me. Please stay home if you're sick. By the way, I am not sick. I haven't slept, so I tend to lose my voice. So I just call on everybody to band and work together. And I also want to say thank you to all of the families out there who have children in child care programs that have reached out and asked how they can help, how they can make sure the employees can continue to get paid while this is going on. So thank you to our community. We have a wonderful community in Nebraska. Just like always, Nebraska is always strong. We will get through this as child care owners. We will get through this as small business owners. I am confident in that. And again, we'd just like to thank the governor.
Well, thank you very much, Teresa. And again, just great examples of industries that are stepping up to meet this challenge. And that is what we have seen all across our great state. Nebraskans have been showing that resilience, that grit, that determination that they highlighted a year ago during the flood and are now highlighting to address this challenge. Nebraskans are stepping up to meet the challenge. So we've got great examples here. What I'd like to do is go into Q&A right now. And in fact, so again, we're trying to practice a little social distancing here. So we've limited some of the numbers of the press from coming in here. And so we've asked for those members who are not here to submit questions to me. And I've got them here, so I'm going to answer some of the questions that we've got here. So, and then we'll go to questions from the press corps that's here. So again, social distancing, right? We're doing a good job here. Henry Cordes from the Omaha World Herald asks, what do you think of the federal stimulus that is starting to take shape? We have been very focused here in Nebraska on the steps that we're taking, so I have not had a chance to read the stimulus package entirely, but we will continue to work with our federal delegation with regard to the steps the federal government is taking to be able to make sure that we all get through this challenge together. So certainly we intend to continue to work with our federal delegation with regard to what's in the stimulus package and how it can benefit Nebraskans. From Shelby Fenster from 1011 News, are property taxes going to be due April 1st, or is there a possibility they'll be deferred? Are state income taxes going to be due April 15th, or will they be deferred like the federal income taxes? With regard to taxes, there is no plan to defer taxes at this point with regard to the April 1st deadline for property taxes. Certainly the federal government may do something along those lines I have not heard that, contrary to this question, but we will certainly take a look at whatever the federal government puts out as a guideline, but right now there are no plans to defer taxes for either property taxes or income taxes. Amy Frederick, question from Hitchcock County News. Our local grocery store cannot order the supplies needed to fulfill all the people's current needs, let alone a 2-week supply, because yesterday the wholesaler began rationing food by only allowing stores to order the average amount of cases they've been ordered over the last 10 months. Are you now expecting to see grocery shortages? And Kathy, I'm actually going to let you address that since you already spoke to that once, but I'll let you go ahead and take a crack at that, please.
So in regard to the shipments that have gone to grocery stores, there was a lag time. It was not due to a shortage of food. It was due to a shortage of drivers. The governor last Friday waived the hours of operation and the weight limits. And so as a result of the governor's action, we were able to get those stores product this week. So as of this morning, the wholesaler that Amy is referring to, I talked to them on the phone and they are 100% as of this morning.
All right, thank you, Kathy. That's good news. From Don Walton, the Lincoln Journal-Star, how many Nebraskans have been tested, and when will the testing capacity increase? I've got Dr. Gary Antone here. Dr. Antone, generally we've got 500 cases that we've tested, and 24 that have tested positive. Correct. That's correct. And in fact, Dr. Antone's team in the public health lab have found a way to increase the capacity by over 4 times. Is that correct?
Through one of the labs, yes.
Through one of the labs to be able to increase the testing capacity. So we are looking at ways to increase our testing capacity specifically in our public health labs. I know the University of Nebraska Medical Center is looking at increasing their capacity, and of course the private sector companies are looking at increasing their capacity. We also were on a call with the vice president on Monday where they were talking about the Roche tests that they are planning on distributing around the country. We're working with our local FEMA region, Region 7, and Paul Taylor down there, who was just a great help when we had the flooding last year. With regard to those test kits, we haven't actually seen any of those yet, but again, as those become available, that will be another way we can expand the capacity. We know that people want to see expanded testing capacity. Right now, we are focusing on the people who are most at risk to make sure we don't overwhelm the system, but we know that we want to expand that going down the road. We are looking at plans, for example, like South Korea and some other states have done with regard to drive-up testing. We are going to be implementing that as we have the capacity to be able to do so here in Nebraska. Well, those are the questions that had been submitted to me via email, so now I'll take questions from the press that is present with us here in the room.
Can you give us a little more information about that testing? You said capacity at a public lab?
So, yeah, so the public health lab we have here has had a capacity of roughly 100 tests a day, and we found a way to increase that to over 400, yeah.
And drive-up testing, how soon might that be?
So we're still working on on how we could actually implement people to allow them to drive up and do that testing, drive up to someplace, be able to get the test and then get back to later. When we have the capacity to be able to do that, and the ability to do that, we'll do that. But I don't have a timeline I can give you right now. I just want people to know that that is in the works as far as the considerations we're taking.
And what would you say, are people complying with the don't gather?
Again, this is how Nebraskans have been stepping up to meet this challenge. We have seen that Nebraskans are complying with the 10-person rule, whether it's at restaurants or bars or any place else where you have public gatherings. Nebraskans are complying. And perhaps this is a good point to really make the distinction between those public gatherings, like bars, restaurants, public gatherings like athletic events or concerts, which we've seen many of those cancel, weddings and funerals. Those also fall within that 10-person guideline. What does not fall within those 10-person guideline is office buildings. Private businesses like that where you don't have the at-large members of the public just walking in to do business there. So office buildings, factories, all those sorts of places, the Capitol here, while the legislature's not in session, the Capitol building is open. So I have no intention of shutting down those private businesses. Those businesses will continue to remain open.
And maybe I should ask Senator Thibodeau later, but I was kind of curious what impact that's had on her daycare.
Well, I will let Teresa Thibodeau respond back to the daycare.
How big is your center? How many?
Yes. Well, so for me individually, I guess we had to go through our census. I am very lucky that I had very many parents voluntarily to bring their children home, so it was easiest for us to comply. All of my parents that are essential personnel do have care for their children currently at my school. Yes, it's going to be an impact to the business because anytime you cut your capacity by almost 50%, you're going to have to make cuts other places. However, I'm confident we'll tighten our belt a little bit, but this country and the governor of Nebraska, they're not going to let small businesses fail. And that's every small business, not just childcare.
Fred.
Is the 10-person rule outside of Douglas County enforceable by law, or is it just guidance?
So right now, with regard to Douglas County, they've issued their DHM, and it's a misdemeanor in Douglas County. We have the option of doing that at the state as well. We've been seeing very good compliance across the state, so we haven't felt the need to do that. We really want to keep it based upon those ESUs. So what we really need people to stick with that 10-person rule, because that's what's going to help limit the spread. If we find we're getting non-compliance, then we'll take further steps. But right now, we really want people to really focus on that 10-person rule, and we've seen that. Nebraskans really are stepping up all across the state to be able to comply with that.
At what point do you recommend not traveling to Omaha, people not traveling across the state?
Well, again, I think for the next 2 weeks or so, the president has really emphasized that people should be limiting their social interactions, that stay at home. So certainly for the next 2 weeks, as the entire country is really stepping up to try to tamp down the spread of this virus, I would discourage people from taking any trip anywhere that wasn't completely necessary. Obviously, if you're going to work, that's necessary, but we're really encouraging people that you really think about staying home and limiting those social interactions. So right now, everybody across the state should be thinking about that no matter where you are.
And what about freelance workers, as far as, the unemployment benefits that might come their way? Is there some concern that they might not be included in any type of relief?
So the question was with regard to, what about people who are maybe self-employed? Is that what you're getting at, Andrew? Or freelance? Contract workers, that kind of thing?
Contract workers who,
Yeah.
who all of a sudden find themselves out of work, but they aren't eligible for the unemployment.
Right. So people who would not typically be eligible for unemployment benefits. In fact, I had a phone conversation with the vice president last night to talk specifically about those folks, or people, for example, who work for nonprofits. Nonprofits typically don't pay into the unemployment system, so their folks are not eligible. And so I asked for the vice president to take that into consideration as they were thinking about future relief packages, to consider those groups of people as well. And again, this is a great opportunity for Nebraskans to really step up. If you know somebody who you can help out, please do that, whether it's an elderly person that maybe needs groceries dropped off or errands run, or maybe somebody who is a freelance person who could maybe be a delivery person for you or something like that. We really want Nebraskans to be creative, innovative, continue to be resilient, and think how we can make sure we take care of everybody in our community.
Governor, in regards to a primary election, it's like 8 weeks away at this point. And we've seen some states postpone their election until June. Is that being considered? Or I know that the Douglas County Board had said that they're going to ask you to allow at least Douglas County to do all mail-in balloting. Where are we in regards to election?
So we are not, at this point, considering moving the primary. If you want to vote by mail, you already can. So everybody who wants to vote by mail, they just need to request a ballot. So I'd encourage anybody who wants to vote by mail, request a ballot. So we'll continue to evaluate other steps that we want to take as we get closer to that. It's still 2 months away, and as you've seen, this is a rapidly developing situation. So we'll make decisions based upon the data that we have, but trying to forecast what's going to happen 2 months out, really at this point is premature. Yeah, Andrew.
And you got a shortage of drivers, for delivering things. Is there any thought about calling in the National Guard to help out, to make deliveries like that? Or is it, or did you get that problem solved so you don't need to?
Well, as Kathy mentioned, with regard to drivers for food trucks, I signed an executive order on Friday that waived the restrictions on hours and weight limits for the trucks themselves. So we expect that the food industry will be able to take care of that. We have not considered calling out the National Guard for that specific problem as of yet. And of course, that's something that we'll weigh for the specific circumstance. But at this point, I don't think there's need. And Kathy, I'd certainly offer for you to say some words about it.
There has been a shortage of truck drivers for several years. And the impact the coronavirus has had on that shortage is we are trying to ship more with the same number of drivers. So our industry is working with other industries to try to get those truck drivers over into our pipeline so that they can drive for us. We are looking for those drivers. There are some drivers that have raised their hand and said that they would be willing to drive, but there are certain rules and regulations and certifications that they must go through. So in the near future, we hope to have that resolved, but in the meantime, the grocery industry is looking for employees. So if anyone's looking for a job, visit your local grocer or your local warehouse. Thank you.
This would be permissible with the restaurant industry.
Joy?
Obviously, bars and restaurants already, a lot of them at least operate on pretty slim margins. So what is the likelihood if, obviously bars have to shut down for a while, or restaurants just have to go to takeout only, that some of them are going to be shut down?
And that's what I'm hearing from my members. It's very stressful for everyone in the country. It is especially stressful for people who operate on those slim margins. And so we're relying on our restaurant owners to be creative. And that is, we have some restaurants who have never had a drive-through window and are not going to put one in. But they can advertise, come to the curbside, pick it up. They can say, we'll deliver to you. Certainly our wait staff who rely on tips. Well, they can become delivery drivers and still receive those tips. And by the way, when you do carry out or go through the drive-through, you can leave a tip. It's okay. We'll take your money because remember, these are your neighbors. They are your friends. They rely on the money that they're receiving. And so we're just going to look at the economic stimulus package and see how that's going to help our business owners stay in business, because we don't want any small business to close.
And if I could just piggyback on what Zoe said, yeah, tip generously. Again, these folks are in a tough economic time here now with what's going on with coronavirus. So if you are getting that takeout, make sure you tip the person really well. If you're getting that delivery, tip the person really well. That's a great suggestion. And then just specifically also, one of the things that all businesses will be able to consider at some point in the future is a Small Business Administration loan. Nebraska has filled out our paperwork and sent it into the Small Business Administration, and when we hear back from them, we'll be issuing more information about how companies can do that and how that will work. But that's going to be another opportunity for companies to be able to get some short-term cash flow to be able to weather this storm. We filed our paperwork with the Small Business Administration. We're waiting to hear back from them. I'm sure there's a number of states that are doing that right now. I doubt there's ever been a time the SBA has taken so many disaster applications from states at one time. So we're hoping they'll process that as quickly as possible. But we also understand that we need to be a little bit patient because they're doing this for the first time, just like we're all doing this for the first time too. Yeah, Andrew.
The feds have suspended HUD evictions. What about private owners?
Well, I certainly would encourage folks not to evict anybody at this time with regard to the financial situation that we've got here. So again, what we want Nebraskans to do is exercise good common sense, right? We're in a public health crisis, right? We have got a public health emergency. We've got coronavirus that we're trying to prevent the transmission. And because of the dramatic steps we're taking to do that, people are going to feel the economic pinch. So I encourage everybody, just be understanding and use common sense.
For the daycare industry specifically, I'm curious, how are daycare owners, say there's more than 10 kids that want to get in, how are you choosing kids in order to allow, obviously, everyone that needs childcare to get in?
Well, what we're asking is, from the state, we're asking daycares to prioritize people who are involved in public safety and healthcare workers So talk about police, fire, corrections workers, doctors, nurses, physician's assistants, you name it. That's what we would ask daycares to prioritize. And I think, and I'll ask Teresa to talk about this in a second, I think that's what Teresa has done at her business. So Teresa, I'll
Yes, so the first thing that we did is we went through the industry that each parent works in. We also asked the parents to let us know if they worked in one of those essential industries, and we defined that to them. So we then made sure that those children had spots first. If we had any spots left over, then we looked to parents who both still have to go to work. For instance, if you work at Union Pacific, those types of things, your job is not shutting down. So we would look at those types of things, and once you get through those two layers, you're pretty full at that point. I would say the rest of the parents have been very gracious in honoring that.
Am I right? You didn't have to turn anybody away at your daycare center, you were able to manage that?
I was able to manage it. There are going to be some child care centers that do have to turn people away. I'm lucky enough, I have 10 rooms in my center. So I can't have 110 children because you do still have to follow your state mandated ratios, just a reminder.
Yeah, we got a question from somebody whose employer works in a big office building, will not let them work from home. Is that, do they have any legal recourse or how's that?
Well, again, what I'm telling folks is, hey, if you've got an office building with 1,000 people in it, and we've asked employers to try and figure out how to work from home, and if you get 500 of those folks to work from home, that's great. We're not going to shut down the office building. We want people to continue to work. So I think that, with regard to a private business, if an individual is uncomfortable, that's really up to the individual to take that up with their employer with regard to how they handle that, because we are still expecting people to work. And frankly, again, if you're keeping proper social distancing, that's how you should handle this. Yeah, Andrew.
The truck driver's exemption, is that just for freight or?
That was specifically for food trucks, I'm sorry,
Oh, okay.
for people hauling food.
So it's not for all the other construction or the trash?
Yeah, no, it's not,
There's a lot of people staying at home now, making a lot of trash.
it's not for any other industry besides the food industry. All right, seeing no more questions, again, I just want to say thank you to all the press who showed up here. Appreciate also you limiting the number of people coming, and appreciate the folks who sent in the questions by email so we could practice that good social distancing. I want to thank Kathy Sifkin from the grocers, Zoe Olson from the Restaurant Association, Teresa Thibodeau representing daycares, of course our sign person, thank you very much, appreciate it. And I want to thank all Nebraskans. Again, what we have seen over the last few days has been unprecedented. There have been some pretty dramatic steps that have been taken. But Nebraskans have stepped up to meet the challenge. And we've seen that all across the state. The Nebraskans are understanding. As Teresa was talking about, parents have been gracious. People are complying with our request with regard to the 10-person rule. So thank you very much to all Nebraskans who are taking these common sense steps to be able to limit the spread of the virus in our community and protect the most vulnerable people that we have, older people with underlying health conditions. So thank you all again. We'll continue to keep you updated as we have further developments with regard to the coronavirus. I'm sure there will be plenty more over the next course of days and weeks. Thank you very much, and we'll talk to you soon. So, Kathy? Thanks.
It's hard to maintain that 6 foot.
Just have to have long arms.
Thanks, Teresa. Appreciate it. Thank you.
Thank you. Fred, do you want my comment?